So today we are delighted to be able to share with you some of our most exciting new research investments. They are truly unique and innovative. These projects span research into the causes, the treatment and detection of pancreatic cancer, and even an exciting piece looking at quality of life and carers. We remain determined to provide the very best support to those affected by pancreatic cancer now, today, and to fund the highest quality research that will transform how we detect, diagnose, and treat this devastating disease into the future.
Our Research Innovation Fund is actually one of our longest standing research schemes and mechanisms of funding in the organisation. We've been doing it for over 10 years. So it means that every single pound that is donated to us by our incredible supporters is really focused on exactly what we need within pancreatic cancer, and that it's its highest possible quality and innovation. So much so that every pound invested in a seed funding mechanism here at Pancreatic Cancer UK, like the Research Innovation Fund, actually translates to a further £7 worth of leverage funding in the future.
In the last, I would say, 5 years or so, that individuals newly diagnosed with diabetes have a very high risk of having pancreatic cancer, much higher than the general population. Even with a very small tumour in the pancreas and very early in the development of the cancer, individuals become hyperglycemic. So there's a lot of reason to believe that this tumour is causing diabetes. My primary interest in that relationship is attempting to use this knowledge to detect the disease earlier. If at that moment in time, when diabetes becomes evident, there was a test for pancreatic cancer, we think there'd be a far better chance of a good outcome for the patient. What we wanted to do by studying and comparing tumours that do cause diabetes with those that don't is to understand the molecular programs going on in those. There must be hints in there that will help us detect the tumours that are causing diabetes earlier. We want to know, can we get a blood test? Will that translate to something in the blood that tells us the diabetes we see in this individual is atypical? It's not type 2, it's pancreatic cancer associated. That's what we want to know. We want to catch that early. My hopes are that an individual who attends a GP with vague symptoms like back pain and dyspepsia, and perhaps has raised blood sugars, hypoglycemia, or progressing towards diabetes, that the GP can say, we've got a test now that we just want to rule out pancreatic cancer, and that test will, for many people, come back negative, for some will come back positive, but will be earlier. Earlier diagnosis will become a reality, because I think this, it's so important, and we know that for all cancers, we know catching it early is huge.